Well, we're gonna get started. Wanted to welcome everybody to today's event, and we're going to talk about a subject that's very near and dear to many of our hearts that have a loved one, friend with dementia, and Gene and I certainly are in that category with our moms. So we're not only as agency owners working with many families with uh, loved ones in various stages of dementia, and we've learned so much in that journey. But it's even harder when it's your mom.
Yeah, family makes it all the
And
difference.
so today, with our just awesome, wonderful presenters and panelists, which I'm going to introduce here shortly, we're going to talk about the challenges specifically during COVID-19. It's hard enough for dementia care in normal times. So let's really kick the dog on the way out and have COVID-19. And now it takes a whole nother level because one thing we know, there's kind of certain things. Change is difficult, especially with loved ones with dementia. So I'm gonna go ahead and share my screen here. And we're gonna go right to the top. So I would like to introduce the starting lineup for today's dementia care. And leading off is Tina, my wife, and registered nurse, and also, by the way, a certified trainer. Congratulations with Teepa Snow's great organization, Positive Approach to Care, which is pretty awesome. Very awesome organization. With us is Latoya Galberth. Latoya is the owner, the heart and soul of Galberth Health, and she is a expert, professionally trained, awesome person in dementia therapy. And she's going to talk about from a occupational therapy approach, working with a client dementia. We're going to have some fun role play too. Also with us, representing the Dementia Alliance of North Carolina, which we're extremely partial to, especially since I'm on the board. But Lisa is programs director. We have teamed together over many years, training. Dementia Alliance is an awesome organization. It's basically an amazing resource to families who have a person or a loved one with dementia. And Lisa will talk about what Dementia Alliance, how can help our fictitious client Emma, which you're going to learn about shortly. Also with us from Preferred Living Solutions is Vivian McLaurin. Vivian is, you'll hear the term aging life care professional or geriatric care manager. Preferred Living has a number of great people in the organization that basically can work with the family from a holistic point, whether they're at home, moving to community, and managing their elder care. And you get to hear from Vivian. And then closing is me.
And you're also PAC certified through Teepa Snow.
I definitely say I'm certified, yes. So let me flip back to our presentation and we'll get started. Okay. Well, I wanted to start and highlight Teepa. I'm not sure, I think those that have been in the elder care for a number of years, Resource for Seniors, I know with us today, Heather and Susan, and great people, know Teepa Snow. She is an authority. She actually got started with the Dementia Alliance, which was previously called the Alzheimer's North Carolina. Lisa was there from the start, Lisa Levine. And then Teepa now has a great organization, Positive Approach to Care, which helps people, guide people, trainers, dementia. And this is something that resonated with us, is that dementia doesn't rob someone of their dignity. It's our reaction. So really, we play a key role in giving them love and making them feel respected no matter where they are in their dementia journey. And Gina's going to talk about that when she talks about GEMS. So really today we thought we'd take this opportunity, speaking of GEMS, is to do a little education, because there's various forms of dementia. It's an umbrella, and there's various stages. And what I love about Teepa's GEMS approach, it looks at the positives. It looks like not what a person doesn't have, it looks at what they have, and then how you can adapt to that and work with it. So Gina's going to introduce that. And then it's going to be cool. We're going to segue into Emma, which we've created out of the spirit of our experiences and our mothers. And we thought it'd be great to how this team would work with Emma in their dementia care plan. And then at the end, we're going to open it up to a Q&A in which Micah will be our facilitator. And we're thinking about 25 minutes of content and then open the floor to questions, and then we'll conclude. So at this point, I'd like to turn it over to Gina.
Thank you. So in our training, we learned that there's 4 truths about all dementias. So at least 2 parts of the brain are dying. Many people think if it's memory, they can't remember, but it's the brain itself that's dying, and it's the it's no longer processing. So 2 parts of it are dying. In dementia, it's always changing. Just when you think you've got your routine down, it changes, and it's progressively worse. And right now, there is no treatment, there is no medication that's going to cure it. Once you have dementia, nobody gets to say, I beat it. So it's not curable or fixable. And so unfortunately, the 4th truth is that it's terminal. But as Teepa says, so is life. So it's how we live it. So I love Teepa's approach. Once you understand where the person is in their journey, you can help with communication. So through the GEMS model, you understand how they're processing information so that we can communicate effectively. It's really important for all of us care partners to work with the person and not do things for them or to them. And if you do that, the frustration decreases. There's fewer episodes of combative behavior, where combative behavior is really the person doesn't understand the stimuli and is reacting and is trying to preserve themselves or putting their hands up as defense. So it's really, working with this model has really opened our eyes, and we're really looking forward to bringing this to all our caregivers as well as out to the community. So just really briefly, these are the 6 GEM states. Sapphires, true blue, this is natural aging. So Tim and I, who are now in our 60s, we know that we process a little bit slower, but that's part of aging. That early stage, that diamond stage, they still seem very clear and sharp, really need their routines. Knock them out of their routines, it can cause real problems. So most people who don't see the person all the time think there's no problem. There's no outward appearance of decline. Then as it progresses, it goes into green, the emerald, ready to go. This person doesn't recognize the changes in their abilities. The constant repetition. What time are we going? What time are we going? They miss 1 out of every 4 words when you're speaking. So they have moments of true clarity and then just a loss of reason at other times. And those are the 2, the diamond and emerald, is what we're really going to focus on today. As it progresses, the folks in amber, they're caught in the moment. They focus on sensation. If it feels good, they keep doing it. If they're tearing up the paper and it makes them feel good, they keep tearing it up. And then they avoid what they don't like. I don't like the water in the shower. I'm not going in there. They react to how people look and how they act, not necessarily their words. They're having a hard time understanding verbal communication. So repetition, repeated motions may soothe them and may really frustrate the caregiver. And you got to watch out because they have very little safety awareness now. As they move down ruby, there's a lot of losses. People can really see it. And it's hard to see the potential inside the rubies. They respond to big movements and they lose their fine motor skills. They have those automatic reactions. If they get startled, they may put their hands up, they may hit as a defense mechanism. But really respond to music. Music throughout, music for all of us can be therapeutic. And then the pearl, it's that beautiful gem hidden out inside that ugly shell. But there's still moments of connection. Communication is more gestures. It's not verbal. They don't understand the words. And unfortunately, at this stage, they're nearly at the end.
Just, I'm hearing a little bit of feedback. If you're not speaking, if you could mute yourself, I think we're just getting a little bit of feedback. That's helpful. Thank you.
So we just want people to know that there's help out there. Many people don't know that there's resources. They say, I didn't realize Dementia Alliance, what do they do? Care managers, I wish I had known about that 10 years ago. So just know that getting help is a sign of strength, is not a sign of getting old or being frail. And that is a big hurdle we jump over with lots of clients. And getting that help may avoid that crisis. So being the nurse, whenever I do an assessment, my first thing is to really get a thorough medical exam, because dehydration can cause confusion, medications. There's lots of things that can alter the way your cognition. So please, please, please make sure that everything else is working fine. Get a thorough medical exam before you think, oh no, I think it might be dementia. Oh,
No, it's good. I just speaking from experience with my own mom a couple of years back, I had no idea there was such a thing called a geriatric care manager, now an aging life care professional. I can holistically manage things, and I actually hired one, and it was one of the more brilliant moves is to get that wingman, and you'll hear more from Vivian on that. So what we'd like to do is, and this is one of our favorites right now, is to introduce Emma. And of course, there's nothing wrong with her. And we're going to turn it over to LaToya now to come up the bat and talk to a little bit about Emma. LaToya.
Awesome. Can everyone hear me okay?
yes.
Awesome.
Yes.
So thank you, Gina. So I'm sure, especially as Gina highlighted some of the stages of dementia and some of their characteristics, that you either had mom or dad or another loved one in mind, because again, you're here trying to figure out your next steps or what resources are available to you. While I want you to keep that image of mom or dad in your mind, I also want to present to you another image, as you see here, and that's the beautiful image of our lovely Miss Emma. So Mrs. Emma is now a widow, as her husband has recently passed away, and she has, I'm sure with some reluctance, had to move in with her daughter, whom she now lives with. So as with most of us, the daughter has now been forced to work from home due to COVID-19 and CDC recommendations to stay at home. Now that the daughter is home more consistently, she's noticing that there are things that didn't necessarily stick out before, and she's now seeing that mom is struggling a bit in certain areas. Of course, as we see, there's nothing wrong with me, replies Mrs. Emma, and she doesn't need help, according to her, although we're starting to notice that she's wearing the same clothing over and over again, and now she's starting to forget to take her medication. There's also been noticeable changes in her physical abilities, as well as now she's at a much higher risk for falls, and she's also refusing to take showers. So now the daughter has summoned occupational therapy to address some of these issues. The daughter is now worried about mom also getting up and wandering during the night, as she does tend to sleep a lot during the day. And Miss Emma was somewhat social prior to the pandemic, but now the daughter is afraid that this lack of socialization, again, due to the stay-at-home orders, will have an adverse effect on mom. However, the rest of the family says, oh, mom is fine, just relax. If I could, I'd add an addendum that says, oh, mom is fine, just relax. Here are some amazing resources for you. So I wanted to start by talking about dementia-focused occupational therapy. So some of you, when you read that headline, you're thinking, oh, wow, we're going to find Miss Emma a job. Not exactly. So most of you are probably fairly familiar with rehab in its more traditional sense, as it's usually prescribed as probably one entity, and you'll usually hear PTOT and speech therapy. So you may not have a clear idea as to what each entity entails, but occupational therapy is truly a discipline that's holistic in nature, with the ability to address physical, cognitive, and environmental needs. So it is truly a catch-all. We're able to marry the physical and cognitive needs and abilities of our seniors while also aiming to keep them safe during that process. Now, I emphasize dementia focus because that is our specialization, and I do feel that that's very important to note. We're able to go in and determine where that person is, again, utilizing the GEMS model and the staging process that Gina alluded to earlier. So I'm definitely going to highlight Emma, but I do know that there are those of you who are caring for loved ones in other gem stages, and they may not be the diamond or emerald that Emma presents herself to be. So just keep that in mind and definitely feel free to ask questions that may be a bit more specific to your loved one during our Q&A session. So going back to Mrs. Emma, the daughter can definitely see again that mom clearly needs assistance. So I wanted to start by talking a little bit about ADL compliance. So that's every occupational therapist's favorite pastime. And ADL is the abbreviation for activities of daily living. And these are essentially your routine, basic self-care tasks that are completed every day. So your bathing, your dressing, your grooming, your toileting, your self-feeding. But we're going to start by looking at Mrs. Emma's dressing dilemma. So in this case, what we would do is to try to encourage our caregivers to play more of an active role first in trying to simplify some of those choices as it relates to Miss Emma's clothing. So if I'm Miss Emma and I open my closet door and there's just a ton of clothing options there, I'm probably going to shut it and say, you know what? I think what I'm wearing is just fine. And again, you have to remember that in these particular stages, that individual sees themselves as very capable and very independent in being able to facilitate this process. So again, we as occupational therapists just kind of use this opportunity to do a little bit more digging or a little investigating. And what I typically ask is, what's happening to those clothes? A lot of times I have clients who, after the day is over with, they'll take off their clothes, they'll lay them nice and neatly next to their bed. They'll put on their PJs or their nightwear. And then when they wake up the next morning, oh, well, here are the clothes that I'm supposed to put on today. And there is no discouraging them to do anything but. So again, it's very individualized again, which is why I do enjoy being out in the field, because I can assist with doing a little bit more of the investigative work. I can make the recommendations and actually assist in the implementation, seeing what works, what may require a different approach, whether it's different time of day or a different intervention that's needed, and also able to figure out if it's only cognitive in nature, because a lot of times there are physical deficits as well. We also see that Miss Emma has an increased risk for falls, so there may be certain environmental modifications that we can put into place, asking where is she falling, are there visual deficits, are these falls occurring in the bathroom, should we consider color contrasting non-skid mats or treads in the shower, are there grab bars in place? Is her ADL and shower noncompliance due to discomfort and fear of falling, which I found are the two most common culprits for a lot of the seniors that I work with dementia? Is it too cold when she's investing? Again, their ability to regulate body temperature is a lot different from ours. Should we invest in a handheld shower head so that they are not perceiving the water is shooting out at them, as that is a true fear, because a lot of our seniors are most accustomed to the sponge bathing or bathing in the bathtub, and just asking how do we facilitate that transition. Sometimes it is contingent on what's going on in the environment, what may have happened the night before, whether or not there was a night before, because Miss Emma may have been up all night and now she's agitated because she's tired, and now we're trying to force her to take a very uncomfortable shower. So again, just taking all of these things into consideration, especially as it relates to our seniors with dementia. And then with the next point, I like to say that OT, we like to put the fun in functional, because we do understand the significance behind doing things that are meaningful by how much joy that they add to the lives of our seniors. So this oftentimes requires homework on our part. And Emma's daughter may need a break, and she may need something for them to engage in while staying at home. So remember, staying at home isn't always synonymous with staying inside. So can mom help with parts of gardening? Can she help fold laundry? Can she fill the bird feeder? Can she help set the table? These will likely obviously have to be modified to a certain degree, again, just depending on where your loved one is staged, but at the core, engagement is there. And as therapists, we like to take some of those functional tasks and create ways to enhance or improve their skill sets. Again, especially if we're seeing both physical and cognitive challenges. Maybe we'll have them complete a jigsaw puzzle while standing on a balance pad to work on improving their balance. or playing bridge to work on sequencing, or writing a card to a loved one that they haven't been able to communicate with during the pandemic to work a little bit more on fine motor coordination. So, what is it that they would like to do? And then, what are their immediate needs? And then, just one quick note that I want to make you all aware of, it's what's called excessive disability. And that's essentially having someone perform lower than their ability level. And this happens all too often as caregivers, where we tend to overdo or overhelp, and we don't allow or provide the opportunity, the interventions, or the environment for our loved one to complete things on their own. So essentially, we can do a bit more disabling than we think by not being able to match that person's cognitive stage with their functional ability. So, of course, Miss Emma's daughter can do the gardening and fill the bird feeder and fold the laundry. But by taking all of those things on by herself and not involving mom, she's definitely doing her the service and not helping her preserve some of those same abilities that are still intact. So next, I wanted to talk a little bit about safety. This would be a good time for Emma's daughter to consider proofing her home now that mom is home more regularly. So this again is where occupational therapy and the home assessment certainly come in handy. Identifying different hazards in the home. We know the prognosis of dementia and the progression obviously is inevitable. So there will come a time where mom is unsafe more often than not. When my grandmother was initially diagnosed with dementia, she was living alone, and members of my family would come in periodically to check in on her and make sure things were okay. And there was one moment where they kind of realized that they were in over their heads when they walked in. And my grandmother had the Tupperware bowl on top of the stove and was cranking up the dial, ready to cook her meal for the day. So luckily, they'd literally gotten there right at the nick of time. And they were able to obviously prevent some pretty extensive damage. So again, just taking this opportunity to be proactive. Is your yard fenced in? If you have a pool, is that covered? Should we consider outlet cover for kitchen appliances to discourage supervised use? I'm sorry. Should we install hidden circuit breakers for the moments that we're not able to supervise mom 100% of the time, because she will make her way back into the kitchen to try to cook herself a meal? Should we consider remote access by way of video cameras, so when we are working from home, we can still sort of have that oversight on mom in the room next door, again, just to kind of make sure that we're doing our part in supervising and making sure that mom is safe. And obviously, I know that there are those of you who have loved ones who may be residing in senior communities, and as a result with the pandemic, obviously they're becoming more and more as exit seeking. So what can you propose to staff to redirect and engage? And that kind of leads into the next point of redefining purpose and participation. So what can we do to meaningfully engage our loved ones? So obviously this pandemic again has disrupted the routine for a lot of us. And what I can honestly say that it's caused an increase in confusion, disorientation, restlessness, and even agitation for our seniors with dementia. So it's important that we continue to engage them in the same capacity that we were before. Now, the manner in which we do so will be a little different, but the continued engagement is so vital during this time. Even something as simple as playing music during their downtime is better than having mom or dad sitting in the room alone. Keeping them connected. Their situation, again, may be a little different from Emma's. And mom is in a community. So again, the option of FaceTiming. I had one of my clients on last week FaceTime her daughter after not seeing her for over a month. And she was there just rubbing the iPad screen and complimenting her daughter on how beautiful she was and how she loved her hair and the clothes that she was wearing and how she wanted those same compliments reciprocated. So sometimes it's even something as simple and small as a video chat or a conversation that's needed in these scenarios. And then lastly, just caring for the caregiver. Emma's daughter obviously now has mom and family at home, and she needs a break. So family dynamics will always come into play no matter where you go. And as much as we can during these situations, trying to add structure is important. So designating areas in the home for your kids, for your workspace, as well as for mom will definitely assist in sort of minimizing that disorientation. seeing in what ways families can chip in, who can assist with meal prep, who can offer a dance or a music session with Miss Emma. We know that as therapists, our time is obviously limited during the day, and we're not able to come in for 4-hour and 8-hour and 24-hour shifts. And we also know that because of Medicare and other payer sources, that some of these services aren't covered for an indefinite period of time. We can't see mom or dad forever. So that's one way that we like to ensure that you have the resources that you need on the back end. And one resource that I feel is very vital is home care. They're the ones that I do consult with most often. They take in that holistic approach in ensuring that our seniors with dementia are receiving their needs physically, cognitively, and socially. And you as the caregiver are also getting the respite that you need. So without further ado, I want to send it over to Gina to talk a little bit more about services in that area.
Thank you, Latoya. That was great. That was great. So you see why we love partnering with Home Health and with Latoya, because that's where home care does come in. When we're asked to meet with a potential client, we take a look. It's a registered nurse at the whole picture, not just at the person who quote unquote needs the help, but the family. We also look at their environment. Is the environment safe? So we look. The most important thing is to find consistent caregivers. As we know, people living with dementia, routines are very important. So having that same smiling face, who knows that I like jelly on my toast and milk in my coffee. If I can trust you with the little things, I just might let you help me with that shower. So we do work with the therapist. We listen. They've done all that homework, and they've told us what some of the great things that would help the client have purpose in life. And those are the things the caregiver does with the client. They can also do the things like make sure the clothes, once the client falls asleep, the clothes get put away and other clothes get laid nicely on the chair. And oh, I guess that's what I'm wearing in the morning. So there's little things we can do to help out a few times. So our caregivers do get a basic training to understand the process, how people process information differently when they live with dementia. Our goal this year is to bring a lot more dementia training to our caregivers and to the community. So when the concerns are, I don't want somebody in the house with this, with a COVID-19. So I will tell you that all of our caregivers, the day before they have a scheduled visit, have to go through a series of questions. Have they come in contact? What is their temperature? Do they have any symptoms? And they have to answer that 24 hours before any visit at all. They also, upon arrival, ask the client and their families how they are feeling. Have they had any visitors? They wash their hands. Washing the hands is just huge. And we have asked our clients that we have on service to restrict visitors in the home, just for the sake of the client and the family and the sake of the caregiver who has decided that, yes, I'm still coming to work. So we do know when we do the assessment, that's a baseline, but it's an ongoing reassessment of the client and the family needs. The client will say, that's okay, my daughter does that. Oh, that's okay, my daughter does that. So we ask the daughter, what is she still able to do? What does she want to do? Maybe if we do the household tasks, she can sit and have lunch with mom instead of trying to run around and get everything done. So it's an ongoing reassessment because not only folks living with dementia change, but all of our clients are changing. We also let the client know that services can be stopped at any time as things change. Maybe family members have come to move in with them, or they're a client that we took care of because they came out of the hospital. And there's nothing better than a client graduating from services because now they're independent once more. So part of our assessment is looking at who's on their team. What can they already do? How can we supplement that? And many times we have families that are just overwhelmed. The daughter's like, I would love to go to all the doctor's appointments. I can't go to all of them. Who on earth can help me with all this? And truly, Tim's mom was in New York and we were here and the business was still pretty new, and trying to quarterback everything that was going on with her was really challenging.
Suboptimal.
It was
Yes.
very suboptimal. And found a great care manager. So that's what we love referring to a care manager. That burden, that someone that can quarterback the whole thing is just really wonderful. And we do refer quite a bit to the Dementia Alliance just for those resources, for all the wonderful educational and for their support groups. So this is a little piece of home care. So I would love now to turn it over to Vivian so she can tell us what aging life care professionals do.
As you can imagine with Emma, you have, I'm military. And if you listen to Latoya, it's like recon. Gina mentioned it's exactly right. We had the recon come back and go, okay, here's the situation. And you've got the general, which is now we're going to introduce the aging life care professional, marshaling of the resources, how we're going to put together this plan. Anytime we have a family that has multiple parts, could be remote siblings, complex medications, we're always like, consider an aging life care professional. So in this case, we made the recommendation and the daughter said, yes, I'd like to speak to this individual. So would like to introduce that individual, and that be Vivian. Welcome, Vivian.
Thanks, Tim, and thanks, Latoya and Gina as well. There's definitely a recurring theme here that it takes a village when someone is diagnosed with dementia, or in this case, the daughter is seeing that Miss Emma is not quite the same as she had been, despite what the long distance family members are saying, that mom is just fine. We love it when, as aging life care professionals, or we're also called geriatric care managers, when our phones ring and we have the opportunity to, first of all, meet Miss Emma. I mean, just looking at her photo, I have so many questions that I want to learn more about Miss Emma. And I also want to get to know her daughter as well. So what is an aging life care professional, and what exactly do we do? It's funny. I have friends and family members that refer to me all the time, yet I'm not sure that my beloved sister-in-law could really say exactly what it is that I do. We describe our roles formally as we're health and human services professionals that take a holistic approach and a holistic look at our client, and our client is always the senior, and then their support network, the adult children, the family members, the spouses, the church friends, and we work to create a circle of support and to really connect the dots for that primary caregiver, in this case, Ms. Emma's daughter. Ms. Emma's daughter's got a lot of plate spinning. She's learning how to use Zoom and do her work from home and keep an eye on mom, and she's pulling in caregivers and learning how to work with someone in her home. She's benefiting from caregivers, from the occupational therapist, and it's just a lot to juggle. So that's where an aging life care manager can come in. We also describe ourselves sometimes as sort of the air traffic controller of the team. If there's anything for certain about dementia, it's that it's always changing. And I think Teepa has said many times before, every day is a brand new day. So what I would love to do as a resource, as a care manager to Miss Emma and to her daughter, is to offer to be an emergency contact, an emergency backup, so that, heaven forbid, if the daughter falls ill, what happens if she is somehow exposed to COVID and her doctor tells her that she needs to self-quarantine or isolate in another part of the house for a week. Um, there's so many things that can come up that when we meet a family, what we love to do is gather all the emergency contact information that we would ever need so that we could step into that primary caregiver, that care partner's shoes, if heaven forbid they have to have a break for whatever reason. Um, and as I mentioned, we like to get to know all the people that play a role in Miss Emma's life, the people that have meaning to her, so that we can help build a circle of support. In this time of COVID, they can't come over to visit, and Miss Emma can't go out to lunch, but we can help do a Zoom social hour, and Miss Emma gets to see her friends, and her daughter gets a break for an hour. Um, when COVID is over, or even while it's ongoing, another service that care managers can provide is to accompany the senior to medical appointments. Yesterday, I facilitated an initial assessment by a psychiatrist for one of my clients that's been diagnosed with early to mid stage dementia. So, telehealth is new to all of us, or to most of us. And we were able to, in the client's home, have a video call with a brand new doctor that he'd never met. Um, and the wife was present so that she could offer her opinions and ask her questions. And I truly was the facilitator in helping repeat questions, to provide background information on behalf of the long distance son that couldn't be involved in that telehealth call. And then when COVID is over and the daughter goes back to work, sometimes, routine doctor's appointments, maybe the daughter, it's not one that she really needs to attend. I can take her questions forward and accompany Miss Emma, ask some questions of my own, provide background information, take notes, and provide a summary after the appointment. And then again, as you've heard Gina and Latoya say, the care partner, that primary caregiver, Miss Emma's daughter, is so important. And it's so important for us to support her so that she can keep all those plates spinning. So one of the things that, as a care manager, we just have um, reams and reams of resources and suggestions and tips and tools and tricks and groups that we can recommend in a customized way as we get to know Miss Emma and her daughter, to see what might help the daughter be able to provide that self-care that she needs so that she stays as healthy as possible. And one of the resources that we share all the time is, we recommend that families contact the Dementia Alliance of North Carolina. You get to speak to a nurse or to a social worker, and they have so many resources and just the kindest staff to listen and reflect and confirm what the family members and the person living with dementia are going through. And so with that, I'd love to turn it over now to one of my friends, Lisa Levine, who's the program director for Dementia Alliance of North Carolina.
Thank you, Vivian, and everyone. What great information we have on here today. We have at Dementia Alliance, our primary mission is just to help people that have been impacted by dementia, whether it be the caregiver, the person living with dementia, the extended family, or whoever, professionals that we work with. I know a lot of times it might be a phone call between our social worker and Latoya and Vivian all coming together to, with the family's permission, to talk about the needs of that family and what we can best do to support them. I think one of the things that I love most about what we get to do is we walk through the journey of dementia with the family, from there might be a problem to what do we do now? We have a diagnosis, and all the way through care issues and end of life issues even. We call our families because they become part of our family as we walk through this. So we decided to coin all of this navigation, dementia navigation, because it's not just resource referral, it's not just education, it's navigating the whole process with all of our partners, like everyone you've heard from already today. So basically, as Vivian mentioned, we have a social worker or a nurse who is right now available through phone calls and videos. But otherwise, you could even come into our office after all of this fun and sit down and speak with those people at no charge to anyone, and to really get help with navigating this whole process, making sure that not only are we supporting the person living with dementia and connecting them with the right resources. Maybe someone hasn't found that life care manager yet, or that home care agency that they need to come into their house and provide that assistance. We help them find those resources tailored to them. We know in Wake County alone, for example, there's over 100 different home care agencies they could call. So who do they call? We help them narrow those choices down. We know the specifics of those different agencies, and so that they can help choose the one that is right for them, the one that has that dementia training, the one that really understands that they're going to be in this person's home, and they have to be the one to lay the clothes out at night. And so they really have to understand that. Through all of this new COVID world that we're experiencing, we've changed some things. At Dementia Alliance, we've created a lot of online video content. We're doing videos and webinars, and we have a lot of blog entries. Some of those things are about what we've already talked about today. Getting someone to wash your hands. How do you help the person with dementia who doesn't understand why they have to wash their hands for over 20 seconds, 2 rounds of the ABCs? How do we get them to do that? So we have videos on those things. We have blog entries on how to keep your loved one engaged and finding purpose while they have to be at home all day. What do we do with them? We have a lot of online support groups now. We have in-person support groups, but of course at this time we're not going to them. So we have online support groups that people can join in. We have done a lot of training for our current support group facilitators, so they now know how to Zoom and set those calls up. And then we also have support groups. I think they had one yesterday for about 20 brand new caregivers to us, who are going through this journey, and they've been doing okay so far, but now they're at home with their loved one. They're at home with Miss Emma, and they realize that Emma's a little challenging at times because I can't get her to take a shower, and I didn't see my mom like this before. Now that I'm with her 24 hours a day, yeah, I see there's a little more dementia, and it's hard for me as a daughter to accept that and to cope with that. And so now I can go online to these support groups and talk to other people that are experiencing the same thing, and know that I'm not alone. Know that definitely that village is out there, and sometimes that village includes other caregivers. We do a lot of resource referral. We also do some respite reimbursement for when a person a caregiver is kind of at the end of their rope, when they really have done everything they can. They pulled in all these resources. They're starting to struggle. Maybe they're not at the point where they're taking good care of themselves yet, and they need a little more assistance. So we do have some one-off respite reimbursement that we can provide funds to have, say, Gina and her team come in and care for someone for a short amount of time to give that caregiver a little bit of a break. We're all human. And I think when we were describing, sometimes people with dementia right now feel a little more anxious, feel a little more like they don't know what to do with themselves. I think we all feel that way. right now. I think we all have limited focus, and things are a little bit harder for all of us, no matter how great it is to be at home all the time. And so sometimes we need a little bit of help. We need that caregiver to come in and give us a break. And another great thing that we do at Dementia Alliance, one of my favorite things that we do, we've talked about music and how important that is for caregivers, but we have a program called Music and Memory at Home. And it's personalized music for the person living with dementia. So what is personalized music? It means that probably Gina and Tim like to listen to some of the same music, but they probably also have a lot of music that's different between the two of them. And Vivian and I probably have music in common, and then we have music that's different between us. And so we look at the music that works specifically for that person living with dementia. Usually it's music that comes from our early teen years, maybe when we were 10 to 25 years old. And we have volunteers who are investigators, if you will. They figure out that music. They send a music kit to the person's home so that the person living with dementia can actually take a break. They can put on headphones. They can listen to their specific music. We usually do 2 playlists, one that is uplifting and gets us going, and one that might help us when we need to take a shower and we're not very motivated to do that. Another is to help us calm down and help us relax. And maybe we haven't been as busy as we need to during the day. And so we need a little music in the evening to help us relax and calm down and chill, if you will. And so at Dementia Alliance, we have these kits free of charge that we can offer to families to help their person with dementia find yet another resource to help them relax, find a comfort. And it not only helps the person with dementia, but it also helps their caregiver because it gives them a break and it gives them a chance to listen to their own music or have that time and comfort and find a little care for themselves. So there's a lot of great resources on this call, and I'm excited that while we all do very individual things, you can hear by each person talking that we do have a lot of overlap. And that's why the system works so well, is because we all work together to find what is going to work for Miss Emma and her family.
Well, that's great. That's great, Lisa. Thank you so much. To have this vision from a funny standpoint, the Dementia Alliance is like that dementia superstore, which has all these resources that all of us kind of orbit around and can draw upon. It's also a sanctuary, a place that's safe, a place that understands. So all of us can benefit from that. I want to quickly, we'd like to get to the Q&A, so we at least get a couple of the audience. But I hope one of your reactions as you listen to each one of the presenters is, wow, I didn't know that. There's such great information. Things like, an aging life care professional, almost like a guardian in a sense, or a guardian angel, somebody that's there for you. So the takeaways is help's needed. You've determined that. It's a team sport. You're not alone. Engage. These great resources you heard from, you can build your team, and we highly recommend it. Great people. You think about if you've got siblings that don't understand what's going on, imagine having a wingman out of like Gina, Lisa, Latoya saying, yes, Emma has some issues. The daughter is right. It's great to have that validation because they're not there 24/7. They're only there phone calls. Now I can imagine that video calls, and Emma looks great, So make a plan and know that with dementia, every day is unique. And you make that plan, but be prepared to change that plan based on what you're finding with Emma. So with that, I'd like to turn over to some questions. And Micah, could you facilitate for us? And we'll take the last 10 minutes, and then we can all have a great lunch. But if you could fire away the question, and we'll put someone on the hot seat from the panel.
Absolutely. Yeah, we've had a few questions come in privately. So one of the questions I think is directed towards Ms. Vivian. She had mentioned, it was mentioned multiple times, but she had mentioned taking a village. So if that's the case, the question is it okay to have an aide or a companion basically like a family member. Is it okay to have them come over to visit with my loved one at this time? And how do I know if they're safe?
Right. So that is a question that I've gotten this week from a wife whose husband is living with dementia, and they're kind of on each other's last nerve of being a husband and wife. We can, I can relate. And they have a companion that had been going out to dinner or to a movie or out for coffee with my client until we all had to go into lockdown. And so the wife and the agency owner and I all talked together, and I asked what the protocol is, and very similar to what Gina was describing, temperature checking, symptoms questions, and the agreement that we came to is that once a week, one person that has been coming into the home previously and is well known and is comfortable with my client will just come to the house, and they will watch a movie on TV together to give the wife a little bit of a break. So,
That's great.
with all the precautions that we've all become so familiar with now, take your temperature, ask those questions about symptoms, and goodness gracious, wash those hands when you arrive at the client's home, and have your mask and your gloves, and be as safe as possible and maintain that physical distance, but to be together in the room watching an old John Wayne movie.
Yeah, the
Awesome.
quiet man's a
Thank
good one. All right, what else we got, Micah? Thank you, Vivian.
Let's see. There's one that was directed toward Latoya. The question is, how do I explain or encourage social distancing and the need to remain at home?
Well, it can be sort of a tricky one and almost a two-part question. I tend to tell a lot of the caregivers and families to not focus so much on the explanation, but just ways to ensure that social distancing is happening. I know for at least, well, all of us, we're making sure that we are putting ourselves in environments and, contexts that won't allow us to interact with someone within a 6 foot proximity. And I think that's sort of the same thing that we'll have to make sure that we're doing for our loved ones as well. I know that it would be super difficult for me to head over to the office of the Dementia Alliance and see Lisa or Dee Dee and not immediately want to give them the biggest hug. So I think we just have to keep those things into consideration. I mean, obviously, to a certain extent, from logistically speaking, if you're helping mom with bathing or dressing, it's kind of hard to kind of adhere to that rule. But there are just certain things that we can do from an environmental standpoint just to make sure that things are in place so we don't have to focus so much on the explanation and saying, oh, well, there's a virus and it's, the death toll is up to here. And I mean, with a lot of our folks with dementia, there's already this sort of pre-existing paranoia. So you don't want to add to that. So again, just making sure that we're doing what we can from an environmental standpoint in terms of the way that we structure activities in our homes, and just the ways that we engage and interact with our loved ones, that we're trying our best to adhere to that 6 foot proximity rule.
Thanks, Latoya.
Mm-hmm.
Thank you very much. This one's directed toward Ms. Gina, home care. So it's been determined that mom needs help, but she doesn't think so. So how will the caregivers, how will they help handle that?
Depending, talking with the family, we have used the approach of, now I realize, Miss Emma, you don't need help, but your daughter's really struggling trying to keep up with the laundry and the meals. So I have somebody that's going to come in to help your daughter. So, and maybe while I'm here, Miss Emma, would you help me? We'll get your daughter's laundry done. So we come in as not necessarily for the client, but for their family member. We've also done scenarios where the caregiver was new to town and the daughter invited her over, and would they like to have lunch together, and they got to know each other and kind of built a rapport as they were friends. They worked on that because this person didn't need personal care, but couldn't be left alone because she would walk out of the house. So they did a lot of walking. They did a lot of walking around the yard and in, up and down the streets. But she was a friend of the daughter. So you kind of find out what the client needs. And then can you come up with a scenario, and the caregivers all buy into it. They know to meet the client where they are, and they kind of enjoy it. So.
Thank you very much. There's another question over toward Miss Latoya. Are Latoya's services covered under Medicare?
Yes, our occupational therapy services are covered under Medicare Part B, as well as some of the other major insurance carriers. So Blue Cross Blue Shield, Aetna, Humana, United Healthcare. There are some instances where, again, just kind of depending on your particular policy, there may or may not be a copay. But in terms of the services as a whole, they are covered by Medicare and other supplemental payers.
Great question. I'm glad whoever asked that, that's great.
There's another general question that came in. With all the talk about PPE that needs to be worn, should I concern myself with that when I interact with mom?
Who would like to take that? Go for it, honey.
Well, if you're living with mom, then that's part of your household. So that would be fine. I think the hard part would be if you're the primary caregiver, mom doesn't live with you. You're taking all the precautions, and hopefully mom is staying home and taking all the precautions, not allowing any other visitors in. Mm-hmm. It would be really, if you weren't living with mom, restricting, making sure she doesn't have the visitors. If you have to prepare the meals and take her places because she doesn't drive anymore. But if she lives with you, you're okay. I mean, if you're helping with showering and personal care, you might want gloves, just like the caregivers use. But for other things, you should be fine.
Great question.
Yeah. Another question, general one. So with this COVID going on, mom's getting a little bit bored. So she wants to stay in bed all day and sleep. Should I just let her sleep?
That's either an aging life care professional or Latoya. Vivian chimed in. There we go.
I have something on that. So if mom sleeps all day, she's like the rest of us. She's not going to sleep at night because she will have, say you only need 8 hours of sleep, she will have got them all day long. And so I think it's important that we do try and engage mom and get her up. I think something kind of similar to what Gina said is really important is, Mom, will you come and help me do this? I really need your help. And whatever that might be, washing dishes, folding clothes, whatever it is, I really need your help. So many times with people with dementia, we often think, oh, they'll watch TV and be fine, but they're not actually understanding what's on television, and they're not comprehending what the people are saying because they're missing some of the language. And so it's actually small little tasks throughout the day that we need to get them involved in. So even matching socks, washing dishes, helping me go outside, let's walk to the mailbox and get the mail. All of those little things add up to activity throughout the day. So it may not be that we're keeping mom out of bed all day long, but maybe she's only napping off and on instead of straight through. I know there's days probably where all of us right now feel like just pulling the covers over our head and staying in home. But we have to get up, we have to get moving and do things. And we all feel better after we start moving around. A person with dementia maybe doesn't have that initiation to start getting up on their own and moving around on their own. But once they do, it's often easier for them to do things. So even if you can get someone to sit up in bed instead of lay down in bed, that's a good start. And then after that, we're going to move into those tasks of activities of daily living that Latoya talked to us about. And maybe it's, instead of getting someone in the shower, it's getting them to wash up while they're in bed. And you know, when you get that washcloth on your face and you start moving around, that starts to wake you up a little bit and it starts to move you a little bit more. So I think instead of saying, okay, mom, we're getting up, we're going, we're doing these things today, come on, here we go, 1, 2, 3, 4, 5. Let's go slow. And let's say, okay, well, you don't feel like getting up, but here, how about just put your feet down on the side of the bed? Let's start here. And then we can gradually get mom to do things. We don't necessarily have to look at them as what activities are we going to do today, because everything's an activity. So sweeping the floor, just making the bed, getting out of bed and making the bed. That's a great activity to get us started in the morning. And we all know in this day and age, once you make your bed, you're not as likely to go down and take that nap and lay back down. So mom's not either. So I think we have to focus on those little things, but it is important that we get up and we get engaged during the day.
Well, thank you.
I think there's one more question that came in. I think a lot of talk about activities, and with the beautiful weather outside, are there safe outdoor activities to encourage for a loved one with dementia?
Well, we haven't heard from Vivian, so Vivian, why don't you address that one? And you're going to be the closer.
Sure, absolutely. And I think that may be one of the blessings in all of this COVID crisis is that the weather is decent and we can get outside. I know that there's lots to do and to get outside together and just take a walk and discover what's blooming in your yard, can be a little bit of an adventure. Of course, we want to be careful. Miss Emma may not have the best balance in the world, and so we don't want to ask Miss Emma to go outside and pick up sticks because we don't want her to fall and get hurt. But certainly to go outside together and do things, check the mail some letters, water the plants or the grass. So definitely, absolutely getting outside. We can't go over and hang out with a bunch of neighbors, but we can stand across the street and wave and talk and just experience and appreciate the birds singing and the squirrels playing around and just getting that wonderful breath of fresh air.
Well, thank you, Vivian. Well, I've gone to unmute everybody. I'm still learning how to use this neat little tool. But we would like to thank everybody, especially our wonderful presenters, for working with us today. The great questions that we had. Thank you, Micah. Thank you, Kyle, behind the scenes. Couple of announcements is that we're going to do this session again Tuesday at 11 o'clock, this coming Tuesday. So if you've got friends or would like to sit through it again, we're going to do it again. I think next we're going to have Melanie Bunn from the Positive Approach to Care and also Dementia Alliance on that call. And then we have other webinars. So, I hope there's some really great things to learn today about engaging, working with somebody, not trying to correct them. And this time it's to keep them calm, keep them feel loved, and you have their attention. And that's great. And the main thing is the wonderful resources, the Dementia Alliance, and all of us surrounding the Alliance can work together as your team. Don't go it alone. Seek that help. We did. It's a blessing to have guardians and friends like the ones on this call. So thank you from all of us for attending.
Thank you.
Thank you.
We have a big bye-bye to everybody.
Bye.
Thank you. Thank you,
Bye.
Angela, Susan.